Hey, hi, everybody, and thanks for joining us on this Friday, December 11th. I'm Mark Zinni.
And I'm Irene O'Connor. It has been another busy day. Let's get you caught up now with the afternoon rush. First here at 4, the race to a vaccine in the U.S. now in the final phase. The FDA has informed Pfizer its regulators are working rapidly to approve the drug maker's vaccine for emergency use.
Now, that means the vaccine could be given to healthcare workers and nursing home residents within days now. Here in Connecticut, health officials are revealing some new information this afternoon about how they'll get that vaccine to the public. Senator Richard Blumenthal talked about it and the timeline earlier today.
We expect that literally tomorrow we will have approval from the FDA for the Pfizer vaccine. Sometime next week, approval by the FDA for Moderna's version. And there is truly light at the end of the tunnel.
Now, Channel 3 Eyewitness News reporter Mike Savino is joining us live right now from St. Francis Hospital in Hartford. And Mike, obviously, you just heard, you know this yourself. We're expecting final approval any day, really any minute. There's word out of Washington tonight. The president wants this to happen by the end of the day. I'm assuming we'll get shipments right away, correct?
Yeah, the CDC is talking about maybe 24 hours after that final approval. There's some other smaller approvals, but everyone's looking at this FDA approval as the last major hurdle for this virus. So, the vaccine rather. So once that approval comes down, it will start coming here to Connecticut and to other states. Both Trinity Health of New England and Hartford Healthcare say they each expect 2,000 doses of this vaccine in that first shipment, with more shipments coming after that. If everything goes according to this timeline of approval today or even tomorrow, that means frontline medical workers could start to get the vaccine as early as the beginning to middle part of next week.
Now, Mike, obviously we have been hearing over and over again that this is really only going to work if everyone takes the vaccine, and there is some concern about that. What's being done to build public trust?
Well, both healthcare networks talked today about the community work that they're doing. They're already trying to partner with some local community groups and leaders to try to build trust in this vaccine. They're certainly aware of the skepticism, pointing out that even among their own staff, some surveys show that about 60 to maybe 70% of their staffs are willing to take the vaccine right now. They do expect that as people take the vaccine, if there are no problems, that will build trust in and of itself. But there is a push to try to convince more people to trust this. We don't yet know what the threshold will be for herd immunity to really help beat this virus. But right now they're shooting for to try to vaccinate between 60 and 80% of the population.
Well, it's certainly some good news that we've had in the past couple of days, Mike. Thank you very much.